I'm just on your mute. Unmute yourself first. Good afternoon, sir. Can we start the meeting? So let's just proceed.
Yeah, please.
Bharti ma'am, please proceed.
A very warm and wonderful good noon to respected Dr. Munish Ahuja and Dr. Sunil Jabla and Chairman Shri S.P. Bansal, Geeta Group of Institutions, and Vice Chairman Shri Ankush Bansal and Nishan Bansal, and all our most valued invited guests and all faculty members and my dear students. It's a privilege having you all here in this webinar. I, Bharti Verma, welcome you all to this webinar on behalf of Geeta Institute of Pharmacy. Today, we are here to have a look on a webinar that is Recent Advances in Ocular Drug Delivery by Dr. Munish Ahuja. Dr. Munish Ahuja is a professor in the Department of Pharmaceutical Sciences, Guru Jambheshwar University of Science and Technology, Hisar. He obtained his bachelor degree in 1995 and master's degree in pharmacy in 1997 from Delhi University and doctoral degree in 2008 from Guru Jambheshwar University of Science and Technology, Hisar. He has 23 years of experience in academics. He has published 92 research papers in the peer-reviewed journals of repute such as Carbohydrate Polymers, International Journal of Biological Macromolecules, European Journal of Pharmaceutics and Biopharmaceutics, RSC Advances, Drug Delivery, Journal of Microencapsulation, AAPS Pharma Science Technology, and the AAPS Journal. His H index is 27 with citations over 2100. He has research interests in nanomedicine, modification of natural polymers, ocular drug delivery, and response surface methodology. He has to his credits 3 books and 1 book chapter. And the 3 books are entitled as first is Piyush Synopsis for GPAT in 2011 and Piyush Synopsis for Pharmacy GATE in 2008 and Careers in Pharmacy in 2006 and 1 book chapter that is entitled as Conjunctivitis Symptoms, Treatment and Prevention. He has successfully completed 1 UGC-sponsored major research project as principal investigator. He served as deputy coordinator of UGC, SAP1 and DST for ST Level 1 programs. He has so far supervised 45 master's students in pharmacy and 10 PhD scholars. He is proficient in handling instruments such as HPLC, FTIR, particle size analyzer, spray dryer, etc. He has conducted several training programs for students and staff on handling of analytical instruments and analytical method development. With all these, he has qualified GATE examination with a percentile score of 92.89 in 1995. And he was also a convener of a 1-week workshop on modern methods in pharmaceutical research organized by the Department of Pharmaceutical Sciences in Guru Jambheshwar University, Hisar from 28th April to 4th of May in 2012. He is a life member of Indian Pharmaceutical Association, Indian Pharmacy Graduate Association, Indian Hospital Pharmacist Association, and Society of Pharmacovigilance, India. So now I would like to call Dr. Sunil Jabla, Principal of Geeta Institute of Pharmacy. Sir, please.
Thank you, Bharati. I heartily welcome my guru, my teacher, Professor Munish Ahuja, who gave me all the things and what I am today due to only his blessings. So he is pathfinder for me. I always take his advice when required. So today I heartily welcome him for this seminar, and I am thankful he accepted our request to deliver the same. So today he is going to deliver a very good topic: recent advances in ocular drug delivery. So ocular drug delivery is emerged as promising strategy for delivery of hydrophobic drugs. Delivery of drugs to the targeted ocular tissue is restricted by various precorneal, dynamic, and static ocular barriers. So today we will see what are the latest development in the drug delivery system. I also welcome Sri SP Bansalji, Chairman of Gita Group of Institutions. I heartily welcome Sri Ankush Bansalji, Vice Chairman of Gita Group of Institutions. I also heartily welcome Sri Nishant Bansalji, Vice Chairman of Gita Group of Institutions, and all the fraternity of pharmacy and all the delegates who have joined us for this webinar. So thank you very much. Let's welcome Professor Munish Ahuja sir for delivering the webinar.
Namaste, everybody. Namaste,
Namaste
all
sir.
friends. Namaste, all the delegates. At the outset, I express my gratitude for the nice words. I express my gratitude to Professor Sunil Javla and the Gita Group of Institutions for inviting me to share my views and on the ocular drug delivery. So here I begin. I am going to share the screen. So ocular drug delivery is a very interesting topic because I had worked on it also, but also uh, because eye is the only organ through which light can pass. I hope my screen is visible to everyone.
Yes sir, it is visible.
So we know that uh, eye is the very only organ through which light can pass. Eye is said to be the window to the soul. We all know there are many आप कह सकते हैं जैसे बहुत सारे बातें कही जाती थी कि you can by checking your eyes you can see what is inside the person. When you visit a physician, he always checks your eyes. First of the exam, one of the basic examination is eye examination. The physician checks your eye for hemoglobin level and other things. Also, it tells what is there. You can see there in our Hindi there is a various types of कुछ मुहावरे हैं जैसे कि हम कहते हैं इसकी आंखों से शरारत झलकती है, ठीक है. There are many movies and many songs which are made on eyes. Eye is a very important organ. Without eye, we cannot see the world. That's why we also call it as window to the soul. Because whatever we get, our beliefs, our emotions, our ideas, we generate it from our senses. And eye is one of the sense which helps us to find what is there. Without eye, it is very difficult to. It is the only organ of our body through which light can enter. So in this webinar, I would be giving a brief introduction. I hope there are some students of undergraduate students also. There might be some research students also. So I would be giving the brief view of from the basic. I will start what is the structure of eye and how it can affect. Further, I will also give you some tips on managing keeping your eyes healthy. So we know these days we are spending most of the time on screen. So in our earlier days when we were young children, we were told that you should not see much of the TV because it will affect your eyes. Nowadays, large number of people use glasses like I am using, many of you might be using. and there is no stigma now. Earlier there was a stigma. People used to say that you should not wear glasses. They don't used to see people with glasses. So one of the reason for this was our elders used to say that you are uh, spending most of the time in watching TV and all things. But nowadays you are seeing you are spending most of the time in computer screen and mobile screen also. And because of this online classes, we are spending most of the time looking at the screen. Now, by looking at the screen, we are because eye is the only organ through which light can pass. The radiation passes through the eye. The one of the major basic reflex which the God has gifted us, this blinking. You are seeing that I have put the blinking eye here. So blinking is one of the most basic exercise which the God has gifted us, which is the blinking reflex to give a protection to our eye, to give soothing effect to our eyes. We have, because of the stress, we have foregone this. Now we are not blinking as much as we should blink. So because of that, there is a lot of stress, and nowadays it is not very uncommon to see everybody putting eye drops into their eyes, and particularly this artificial tear eye drops. Everyone is maybe using. Maybe he's having some problem or not. Otherwise, whenever there used to be some problem, only in that case we used to put some formulation into the eye. But nowadays everyone is using because everyone is having some problem, and there is a dryness of eye because of this screen time, because we have stopped blinking. So when we are going to use some formulation in eye, whenever there is some problem in eye. So what are the problems that you can see whenever there is an injury in eye, when there is inflammation in eye, or like I told you that in dry eye syndrome, it is when you are working most of the time on computer, mobile, we also need to use eye drops because of the strain on eyes. It becomes redness is there and inflammation is there, pain is there. So most of the people use eye drops.
Sir, one kind request. Your screen is just blurred. Kindly you can share the screen again.
My screen is not
The
visible.
screen is just blurred. Yeah, it is visible, but it is blurred, sir. So can you share me it again, sir?
The text is not visible clearly. So
Okay.
just stop share and repeat it again.
And again, share, sir.
You can share screen again.
Okay, okay, okay. I have done
Please, sir. Kind request.
my screen sharing and all this. Let me share only my presentation. Okay. Then I think it would be better. Is it visible now?
We are waiting, sir. It is starting.
Yeah.
It is visible, sir. Just it is just we are
Start
not
the
able to read
slideshow.
the content properly. Just showing the blurred.
Is it visible, my topic?
Topic is visible, sir. Maybe some connection problem may be there, sir. So if you so once you just stop the screen sharing and connect again, sir, it may be corrected.
Okay. I leave the meeting and then again connect. Is it okay? Shall I leave the meeting and again connect?
Yeah, just screen sharing, sir. You stop the screen
Okay.
sharing, sir.
I have stopped it.
Yes, sir.
Again connect, sir, please.
Now?
Yeah, now it's visible.
Yeah,
Yes,
sir.
sir.
Now it is visible, sir.
Okay.
Thank you,
There
sir.
Thank you,
is
sir.
some
Thank
bandwidth
you, sir.
problem because more than 100 participants are there on this. That's why.
Yes, sir.
Yes,
Okay.
sir. Again,
So
again happened.
mhm. Again, it is not visible.
Again, yes, sir. Again blurred, sir.
Now this image.
So text is
It's
not visible.
it is blurred, sir. So please once again, please do it.
If you wish, I can send the presentation also if there is someone else who can at
Okay,
your end.
okay, sir. Oh, yes,
Yes,
yes, sir.
sir.
Vivek, can you help us?
Sir, my screen is sharing on YouTube, so I think I can't help you. It is possible that sir will send you to share the screen by your
Yeah,
own hand.
we
You can
can
share.
share, sir.
Yeah, ma'am. Okay, ma'am.
Okay.
So presentation is required. Can we share it?
Yes, sir. You can share your screen, sir. I think it is better than, because our bandwidth is quite better instead of sir.
Maybe some problem
Okay,
net connectivity.
just wait, because it is having some videos also. So let me
Yes, sir.
see how much is the.
Dear participants, just wait. Sir is doing the corrections. Simran, madam,
Yes, sir.
can you share your screen and show us some of the slides of GIP in between?
हाँ जी, sir.
We are resuming within 2 minutes. The file is downloading. Please wait for 2 minutes. Please check it is visible.
Sir, it's visible.
Okay.
Content is clear also.
Sir, kindly continue, sir, please.
Sure, sure. So I am sorry for this problem. Now let us begin.
No, no, sir, it is our fault. No problem, sir.
No.
Please continue.
So topic of today's talk is recent advances in ocular drug delivery. In this topic, I would be covering the various challenges faced in delivery of drug to the eye. They are We can deliver the drug either by topically administering the drug, or by systemic administration by oral route, or by injection, or there are certain periocular routes where we inject drug directly into the eye. Now, we know if we want to give a drug to the eye, the most suitable method is to give the drug topically, directly into the eye. Now, when we going to use a drug in the eye? Only in those cases where there is a problem in eye. For example, there is inflammation is there, or some uh, other problem is there, injury is there, some infection is there. In that cases, we try to give the drug to the eye. Now, if we give a drug by oral route or by some other route, there's a very small amount of drug reaches the eye, because the eye has been, the structure of eye is so peculiar, because it is the only organ through which light can enter, and that's why it has been designed in such a way so that there is a very if you see the, please, yes, please, can you show the next slide?
Yes, sir, please.
This is the structure of eye. You can see here there is a, on the top is written light. Light is entering, and the blue part that is here is your cornea, and from this then the next is lens, and then is this the red part below is a retina. The image that is formed, if there is a image is not correctly formed on the retina, then we say either is before the retina or behind the retina, it is not properly formed, then there is a problem of eyesight, short-sightedness or far-sightedness, called myopia, hypermetropia. If there is a problem in lens over a period of time, we call it becomes cataract. And if there is a certain problem, there is a, please next slide, please. So you can see there are two segments, the anterior segment and the posterior segment. We can divide eye into two chambers. One is this is the cornea, the front blue part you are seeing. It is the only part through which light can enter. Now, how it is possible? It has been possible because of the structure of cornea. Cornea is made up of certain proteins, and which are arranged in such a fashion that light can enter through it. अगर ये कॉर्निया के प्रोटीन डैमेज हो जाए, then it becomes opaque, then one becomes blind. So whenever there is an injury into the eye, we have to be very careful, and that's why anything which we are inserting into eye, any formulation we are pouring into our eye, which are administering into eye, we should be highly careful that it should not be containing any microorganism, because if any infection takes place there in the cornea or something like that, then what can happen? Because inflammatory response will be initiated, and the cornea is the only organ where there is no blood supply. Now, because of to overcome that inflammation, blood will come and all these things will happen, and the cornea will become damaged. If the cornea is damaged, then one will become blind. In case of when we say that one should donate eyes, when after the death, the only portion which is replaced is the cornea. Basically the transplantation is done of the cornea done, and after this cornea, there is a liquid chamber, anterior chamber, which contains aqueous humor, which is a slightly liquid, just like water, and beyond that is a lens. And here, after the lens is a posterior chamber. Now the posterior chamber contains your vitreous humor. If there is a problem in the lens over a period of time, the lens is also transparent portion, the light passes through the lens, but with aging, this lens loses its because of its proteins gets crystallized, or its proteins gets precipitated or becomes insoluble, then results in the cataract. Now in cataract surgery, this lens is removed and an artificial lens is inserted. Nowadays lens transplantation is there, then intraocular lens is added, which is made up of a particular kind of a polymer. But earlier, when the lens was not transplanted, then what we used to do, we used to remove the lens, and we had to use glasses which were very thick. Now, by replacing this, nowadays different types of lenses, foldable lenses, and different types of lenses are there, which are inserted here by phacoemulsification surgery, and which are very good, and they can transmit the light. Now you can see here in the between the posterior chamber and anterior chamber, there's a small portion which is not exactly visible here, but from where the liquid from the posterior chamber enters the anterior chamber. Uh, Please next slide. In the posterior chamber, the liquid is known as vitreous humor here. So in case of vitreous humor, this is transported into the anterior chamber by filtration. But if this, in the earlier slide you have seen, if this is blocked, there is a small vein, small pore through which the liquid enters into the anterior chamber. But if it is blocked, then there is a problem of increase of the pressure inside the eye. This is results we call it as glaucoma. In Hindi we call it as kala motia. Safed motia, you know, is motia being this cataract, and kala motia is glaucoma. Now this is the problem with one more problem of the eye, and another problem which is most common occurring most commonly these days. It used to be earlier also, but now it has been recognized. The disease of the posterior segment in the you can see here macula is there, blind spot is here written here. So if there is a degeneration of the cells here which take place because of the diabetes and other problems, there are various problems in part of this posterior chamber with uveitis and other inflammations are also there, and it is very difficult to treat the disease of the posterior chamber because drugs cannot easily enter into the posterior chamber. For drug to enter into the posterior chamber, it has to pass through the blood retinal barrier, because the blood is, अगर सब कुछ blood आपका जो brain में जैसे blood brain barrier है, ऐसे anything if you allow to enter into the eye, there will be a problem in vision. So God has created barriers so that only a few certain required things can enter into the retina. So there is a blood retinal barrier, just like a blood brain barrier. If any molecule which you eat is goes into your brain, then you will become mad. Similarly, in case of retina, if anything which is you take orally, if it enters into your retina, it will create a problem in your vision. So there is a filtration mechanism, blood retinal barrier, because of which very small amount of drug enters the retina. Now this is a problem also for us, because when we have to give a drug for treatment of diseases, then difficulty is there if by administering orally, or by we have to either administer a drug directly into the eye by injection or by topically. Next slide, please. Now, the various barriers, they depend upon the various routes of delivery. For example, most commonly, what would one prefer? Topical delivery. आंख में कोई problem है तो आप क्या चाहेंगे? आप सीधा चाहेंगे कि आंख को treat करें. For example, if I have a problem on skin, what will you do? Skin पे infection है, skin पे चोट लगी, that we also take antibiotic, but the most common first aid treatment and most easiest is to apply antiseptic on the skin. Similarly, if you have a problem in eye, we should apply a drug on the topically. But once it is easier to apply a drug topically because maximum amount of drug can enter at the site by topical administration. However, if you can, it's a prolonged case, for example, some infection is there, it may go inside also. We also give a drug by systemic and oral route, by injections also. But the most common patient-friendly route is topical delivery. So depending upon this, there are various challenges to the, there are various types of barriers which prevent the entry of drug into the eye. Next slide, please. So in case of topical delivery, it is most common, patient friendly. Anyone can, if अगर आपको किसी को भी eye drop दे रखी है, one can easily administer. उसको किसी की help की जरूरत नहीं है, ठीक है ना? खोल के डालनी है, but injections, if one has to go to the doctor or to the nurse or to the admit in the hospital for injection. So it is a non-invasive and easily acceptable. बच्चा भी डलवा लेगा, otherwise no one will try to have an injection. Now, also the drug is delivered at the site of action. For example, if you have disease of the anterior segment, like conjunctivitis is there, or inflammation of infection on the anterior side is there, it is easier to give the drug by anterior route, topical administration. However, it can also be used to deliver the drug into the posterior segment, like macula, in case of acute macular degeneration or retinal derangement, or in case of problem with the vertigo. Many infections also take place in the posterior chamber. Some autoimmune diseases also take place. So for treatment of that, you can deliver a drug by topical administration also, or also by certain injections. Now, in case of topical administration, the drug enters the either by through the cornea. You are seeing here in the front, it is written as topically, pupil and cornea is there. If the drug enters from this portion, is called as transcorneal. इसको कहते हैं cornea, transcorneal. आपने हमारी आंखों को देखा है, इसमें ये जो व्हाइट वाला पोर्शन है, द व्हाइट पोर्शन इन अवर आई, वी सी, आप देखते हैं ब्लू एंड ब्लैक पोर्शन और ब्राउन पोर्शन. दिस इज बिकॉज ऑफ द कलर ऑफ द आइरिस विच इज देयर. पिपुलिस, आइरिस के सेल्स जो हैं उनका कलर है, इसलिए आपकी आंखें दिखती हैं ब्राउन कलर की, ब्लू कलर की, झील सी आंखें, नीली. पीपल से लाइक दिस इज बिकॉज of the color of the iris. Otherwise, the cornea has no color. Cornea is a transparent membrane. So the drug enters the into the anterior segment mainly by topically through passing through the cornea, which is called as transcornea. But the white portion of the eye, through which light cannot enter, here it is written as sclera. If you see in the top, it is written as sclera. If the drug goes inside the eye through sclera, it is known as transscleral. Now, apart from this, there is a conjunctiva also. जो आपकी आंखों के पास जो आपकी पलकें हैं, इसके नीचे का जो पोर्शन है जिसपे डॉक्टर चेक करता है ब्लड वेसल, which is known as conjunctiva. The drug can enter also by conjunctiva, but the drug which is going through conjunctiva is also entering your systemic circulation. तो यूजुअली जो भी आप मेथड अडॉप्ट करें, इन दिस केस टॉपिकली ओनली लेस देन 5% ऑफ ड्रग रीचेस दी आई. तो इसलिए डॉक्टर प्रिस्क्राइब करता है कि आप बार बार आंख में आई ड्रॉप डालें. He will say you put eye drop again and again, and you might have seen when you administer the drug, you also get a taste in your throat also. आप कुछ ले रहे हैं, आपके गले में दवाई का टेस्ट आ जाता है. Why? Because the drug is lost. आपकी आंखों से हमेशा आंसू निकलते रहते हैं. Tear turnover is there that passes through your nasal to pharynx to your larynx, आपके गले में आ जाता है और उससे टेस्ट आता है. तो there is a loss of drugs. Entire drug is not available. Next slide, please. Next, transcorneal delivery. Now, what is the problem with the transcorneal delivery? One is the this you can see the cornea. The structure of cornea, it is basically made up of epithelium, then stroma and endothelium. And in between epithelium and stroma is basement membrane, and between this stroma and endothelium is descendant membrane. The major barrier to transport of drug is stroma and epithelium. 90% of the portion is stroma. Now, stroma is made up of your is hydrophilic, means water soluble collagen fibers are there, while epithelium is a lipidic portion made up of lipophilic cells, epithelial cells, tight junction cells. So इसमें स्पेस बहुत कम है, टाइट जंक्शन है, वेरी स्मॉल अमाउंट ऑफ ड्रग कैन एंटर. और जो ड्रग इसमें से पास कर सकती है, इट शुड बी लाइपोफिलिक इन नेचर, मींस it's oil soluble drug. Now, in the case of stroma, which is 90% of the thickness of the cornea, aqueous soluble drug can easily pass through it. And after that is endothelium. Endothelium is again lipophilic. So there is a lipid barrier is there. So those molecules which have both aqueous and lipid solubility, which have a optimal solubility, जो पानी में भी dissolve हो सकते हैं, जो hydrophobic में हैं, only that can easily pass through this anatomical barrier. They can easily through the cornea. Next, please. Apart from this, if you see when you put something into eye, there is a loss of drug also. For example, this drug is also will not exactly go through your conjunctiva. It will also be absorbed into your systemic circulation, either through your mouth. It will go into your, जैसे आपको बताया गले में, if you feel the taste in your throat, it will go inside through that route also, and also through conjunctiva it will be transported. There are large number of blood vessels in your conjunctiva. I told you that whenever a doctor checks, he checks your eyelid and sees there is a blood vessels. There are blood vessels are there. They must be red. If they are not red, he is not able to see the blood supply. He will say that you are anemic patient. So because of this blood vessels, this blood is this drug goes through this blood capillaries and is transported through this blood vessels. Part of the drug reaches the eye, and most of the drug reaches into your systemic circulation, into your blood, into your other body part. It will go into heart and other places, and it will also cause side effects, because if you want a drug only for eye, then it is a desired effect. But the drug that reaches your other body part will show effect there also. That's why it will also cause side effects. So another barrier is your transconjunctival delivery, which is taking place through the. Next, please. Now, transsclera, I told you what is sclera. Sclera, the white portion of your eye, which is the major portion. Drug can also pass through it. A very small amount of drug passes through it. It is made up of collagen fibrils and proteoglycans. And here, it's if you see the permeability, the drug is permeable similar to the permeability in stroma. Cornea में 3 लेयर बताई थी मैंने, epithelium, stroma and endothelium. The permeability of sclera is similar to that of your stroma. But is inversely proportional to molecular radius, means bigger size molecules are difficult to pass through it, but smaller size molecules can easily pass through it. Further, you can see that if the molecule is positively charged, positive molecules, they will bind to proteoglycan matrix and are easily transported. In case of negatively charged molecules, they would be repaired by proteoglycan matrix, which is made of this sclera is made of this. So they will be having certain problem in pass through. So positively charged molecule can easily pass through this transscleral route. Next, please. Now, if you can also give a drug by oral route. Now, most of the drugs are available by oral route. It is easier to administer the drug to the patient. It is also non-invasive, no injury is there, no injection is there. But here the availability is still less than, in case of eye, the only less than 2% of the drug which is administered orally reaches your eye. For example, if you are taking a 500 mg of drug and of this only a very small amount, let us say 400 mg or 450 mg reaches your blood, then out of the 450 mg, only 9 mg of drug, less than 9 mg of drug would be able to reach inside your eyes. So, but again, it is used for treatment of various diseases, for example, scleritis and episcleritis of anterior segment, and for treatment of uveitis and cytomegalovirus retinitis. These are the infectious diseases which take place in the viral diseases in the posterior segment, and for treatment of this, it is most commonly used in addition to the topical delivery. Topical delivery is preferred, but in addition to this, they also use for this. Now, the main problem for delivering the drug to the anterior segment is the blood aqueous barrier. You can see in the aqueous humor, first the drug will reach the posterior segment because there is a blood retinal barrier. A small amount of drug will pass filter and get inside the retina, inside the posterior segment, and from there it will slowly diffuse into the aqueous humor. So these are the main challenges which prevent the entry of drug into the eye from oral route of drug administration. Next, please. Now, this is the blood retinal barrier. You can see I am showing here that there is a capillary, blood capillary. They are tight. Inner blood retinal barrier is there, and this is the outer blood retinal barrier is there. Retinal pigment epithelial cells are there. This is choriocapillary leaky. Because of this barrier, only a small amount of drug reaches the retina. Drug has to pass from here, capillary, to this side. So a small amount of drug can enter here, very small portion. Next, please. This is again showing the scheme, how the drugs enter. You can see from one side to another. We have already explained. Next, please. Now, another route of drug is by injecting the drug directly into the eye. Now, it is a very painful, and no one would like someone to insert the eye needle into his eyes. Very difficult, and it requires the services of a trained ophthalmologist or trained physician or trained paramedical staff who can inject directly the drug into the eye, because it may damage the eye also, and one may become blind also if the drug is not injected properly. Now, the various routes, this is basically mainly used for treatment of posterior segment disease, because if posterior segment disease like cytomegalovirus retinitis or something, acute macular degeneration or retinal detachment, if they are not treated properly at a time, one may become blind. So for that purpose, this route is used. In this periocular intravitreal delivery, various routes here are shown. In first, you can see subconjunctival route here. The drug is injected into the conjunctiva. From there, part of drug also reaches the It is just like insulin injection we take transdermally. Here also it is injected into the conjunctiva, and then there is this subtenon route. You can see here, it is shown here. It is basically used for treatment of administration of anesthetics before the surgery. Then peribulbar route is there. It is also used. Here you can see here the drug is, it is less invasive than other routes, because here the drug is not injected into the your eyeball, but behind the eyeball is there. So one has to be highly careful and highly trained so that it is not injected into the eyeball, but behind the eyeball. From there the drug also enters this. Then there is a retrobulbar route here that is below this the eyeball. Then the most difficult route is this intravitreal route. Here the drug is injected through the sclera directly into the vitreous chamber. So the drug which is given to the intravitreal route, it will remain in the mostly depot formulations. Those formulations which once injected will remain into the eye for many months or weeks, can be used for treatment. In this case, many steroidal formulations are injected directly into this, for that they remain into the eye for a prolonged period of time, for once in a month or once in a 6 month injections are given, so that help in early recovery of the patient. Otherwise the patient may become blind. So this route is also there. Now there are other I will show you various advancements, because of which these non-invasive methods are there, which can also be used for delivery of drug without injection. इंजेक्शन लगाने की जरूरत नहीं, अब बहुत सारे मेथड अवेलेबल हैं by which you can deliver the drug directly to the posterior segment. We will see some videos are also there, you can see. Next please. Then again I am showing the various routes which I have shown here. In case of subconjunctival delivery, its main advantage is that it does not go into the conjunctiva. It delivers the drug both to the anterior and posterior segment, and is used for depot formulations, those formulations which can deliver a drug over a prolonged period of time, and has been used commonly for the treatment of glaucoma, cytomegalovirus retinitis, acute macular degeneration, posterior uveitis. All these are the diseases of this AMD, CMV, posterior. These are the diseases of the posterior segment where it is difficult to reach. But another challenge is that some of the drug is also going into the conjunctiva, and some of these is passing through the colloidal circulation into the body. So again, there is some limitation is there, but it is better than it is more better than topically application to deliver the drug into the posterior segment. Next please. This is for subtenon delivery. It is less complicated than intravitreous injection, and it has been used for treatment of these diseases like diabetic macular edema. Because of diabetes, so many people are losing their eyesight, and because in case of diabetes, our higher sugar level, there's a lot of oxidative stress is there, and because of this oxidative stress, such kidney damage, eyes, peripheral neuropathy, and peripheral neuritis, or ocular inflammation, or macular edema, so many problems are there. So diabetic patients have to be highly careful. They should regularly get their eyesight tested for this problem. And the problem is that you will not come to notice this problem only when there is a vision problem. They are difficult to see. It may happen silently, and a patient will not come to know only when he will come to know that there is no light, he can't see. Then it becomes very difficult. Advanced stage one comes to know. So regular checkup is required. So these are the diseases where it can be used. Here again, these are certain challenges for delivery of drug. There is a retinal pigment epithelium which prevents this entry, and chemosis and subconjunctival hemorrhage. There may be some inflammation and leakage of material which causes a problem. Next, please. Then is retrobulbar delivery. I have shown you earlier the routes. This is basically used for administration of anesthetics. It has a minimal influence on intraocular pressure because the drug is not injected into the eyeball. So there are minimal chances of the enhancement of the ocular pressure, because if ocular pressure rises, then glaucoma and pain that may happen. It may damage the eye also. Now, before surgery, anesthetics are to be administered. So this is one of the way by which drugs can be administered. mainly used for administration of anesthetics before surgery. Next, please. In intravitreal delivery, this is the only method by which you can reach directly at the retinal into posterior chamber. So there are maximum amount of drug level can reach the posterior chamber only by this route, and it has been used commonly for these purposes. These various diseases, diabetes, macular edema, cystoid, they are various different eye diseases of the posterior segment for which they are used. But again, if the injection is not injected properly, it may lead to detachment of the retina, which will be very difficult, or there may be leakage of blood, hemorrhage might be there. Patient will not be, how it is very difficult to convince the patient that the drug would be injected directly into the vitreous chamber. How, no, very few people will allow. Only in those cases which they see that either they will become blind or they will allow. Then there may be some damage also, cataract may also be there, or endophthalmitis, inflammation, infection chances are also there, because when you are injecting something, then it may also uh, cause some other damage problems also. Next, please. Now, for treatment of anterior segment, how to improve the drug delivery to the anterior segment? This can be done by conventionally by application of suspension, ointment and gels. You know, अगर हम simple eye drop डालते हैं aqueous, it is lost because of the tear turnover, because of lacrimation, because of some other blinking of the eyes, small volume of this. But if we put something which retains there for a long period of time, we can promote the more entry of more amount of drug. You know, in cases of conjunctivitis and others, people use, doctor usually give you some eye caps also there, chloramphenicol eye caps, or some ointment for insert administration. Now this ointment and this eye caps and gels, they are much better. They will provide a drug delivery for a prolonged period of time. But the only problem is that they cause problem in vision, because they are sticky, they are viscous, and they show hazy. And so for a small period of time, there may be hazy vision. So people generally use it for nighttime administration. But if they use, they can provide a drug into the this area for a much prolonged period of time. To overcome these problems, various novel systems have been generated. In case of in situ gelling systems, they are also easy to administer, because administration of ointment and for eye caps, it is very difficult. You have to cut and you have to put into eye, difficult. But in case of in situ gelling system, it is just like a liquid. Once you pour into the eye, it comes in contact with the eye secretion and at the eye pH and the lacrimal fluid, with the tear fluid, it becomes solidified, it gels. So it is easier to administer than administration of gels. Then there are ocular inserts. These are the small polymer films which are inserted into the eye, just like your contact lenses. Then there are mucoadhesive systems which are not easily washed. They remain bound to the conjunctiva and other portions. So even if tear is flowing, they will remain there. So they prolong the delivery of drug into the eye. So this is the strategy which is commonly used for delivering of drug to the anterior segment. Next, please. Uh, Another method is to enhance the delivery of drug into the eye. Now, most commonly preservatives have been used in eye drops. Preservatives, benzalkonium chloride, or others are most commonly used, phenyl mercuric acetate, these days mercuric preservatives are not recommended, but there are certain other preservatives. Now, they have also been found to enhance the delivery of drug into the eye. What they do, they cause a slight transient irritation and transient damage to the cornea, through which increases the thickness gap between the epithelial cells and promote the delivery of drugs. Same is with the case of surfactants. आपने देखा होगा whenever we take a bath, something goes into our eyes. अगर आपके आंखों में साबुन चला जाता है, सर्फेक्टेंट लगते हैं, देन शैम्पू चला जाता है, तो कितना इरिटेशन होता है. दिस इज बिकॉज वो वहां पर कॉर्निया को डैमेज करता है एंड प्रमोट्स द डिलीवरी ऑफ ड्रग. सिमिलर इज द केस विद EDTA. इट रेट्स द कैल्शियम आयन एंड इंक्रीजेस द gap between tight junction cells and promotes the absorption. In case of cyclodextrins, these are the molecules which increase the solubility of hydrophobic molecules and they, because increasing their aqueous solubility, they promote the absorption. Similar is the case with pegylated system. In this, polyethylene glycol is reacted with your molecule is reacted with polyethylene glycol, or your nanoparticle is coated with polyethylene glycol. This also promotes the absorption. Then pro-drug approach is there, because many drugs are not having a optimal hydrophilic lipophilic balance, or pKa. They are not easily absorbed. By making pro-drug, you can make their solubility such that they can easily pass through the lipid soluble barrier, lipid barrier, as well as aqueous barrier. Another route is by use of colloidal carriers like liposomes, nanoparticles. These are now being used. They are also absorbed. They are our bodies, as the endothelial as epithelial as they go uptake of this. They absorb them by active transport also. And because of their size, they can easily penetrate inside the eyes. So this is one of the strategy. Next, please. Now, for case of posterior segment, now this various techniques have been used. One is the use of microneedles. Microneedles are very small needles, micron size. You would not even come to know that you have been, if microneedle is inserted. No pain, no damage would be seen. They are very small. Small patch is there, and it is commonly have been tried. It is basically on a currently in a strategies are only restricted to research also, but no formulation has available till now. But commonly have been tried for topical application for skin also, and another is ionophoresis. There are few couple of products available in the market. Polymeric implants, they are also available. Then transported target drug modification. In this case, some research has been done, some formulations have been prepared, where a drug molecule has been modified by attaching some transporter, which is easily absorbed. So next, please. Here you can see this is the various approaches which is have been shown here. You can see the A, which is here. It is a topical application formulation. I would be showing here also visual X. You place it over the eye, allow the patient to stand there, take a rest and keep it there, and then apply there the drug. You retain the drug for prolonged period of time. This is used for ionophoresis also. Then there is a, you can see various approaches are here. C, and injection is shown here. Subtendon injection is there. D, you can see unidirectional implant is there. Here you can place implant here. And then there is a use of this microneedles. E, solid coated microneedle. You can see these can be placed here. Here inside you can see bigger image where microneedle is shown to be used here. Then you can see this G. This is free floating intravitreal implants. They are injected directly on the right side. You can see here we have shown G, H, I, and J here. So all these are shown. There are various ways. In this picture, all the various strategies have been shown schematically. Next, please. Now, so you can see that you can also administer the drug to the posterior segment by topically. Now, जो आप drug administer करते हैं corneal से topically, a part of drug which enters through the anterior segment is also transported into the posterior segment. This blue color you can see, this is also entering through known as transvitreous route. But this is small. Another is by uveoscleral, the drug which is going through the sclera, and third one is your periocular, the drug which is passing through the sclera. Here the drug is green. You can see the drug is entering through the cornea and then to the sclera. And in case of transvitreous, the entire drug is passing through the sclera. So these two routes can be used for the drug which is applied topically also reaches the posterior segment. But these are the three mechanisms by which the drug applied topically enters the your anterior posterior segment. But this is small. There are various ways by which one has increased. One is this red portion. You can see scleral route. Many people have tried, and I will show you also. Here is a video also. You can see where the drug is passing through this route also. Next, please. So if you give a drug by topically, it has been shown that a significant level of certain molecules can be easily achieved. This in case of mementamine, nepradelol, brimonidine, nepafinac, and dorzolamide, only by topical administration, sufficient amount of drug could be delivered to the posterior segment. However, because they have certain physical chemical properties, but every molecule doesn't have this type of physical chemical property. So one of the mechanism by which they have reached this is by melanin binding, which sustains the drug delivery. The drug binds to the melanin, and because of that, it can provide a sustained delivery over a prolonged period of time. Next, please. In this case, what is done? A mixed micellar formulation has been prepared. You can see a drug molecule is voclosporin. To this, vitamin E top of TPGS have been attached, and octizionol 40 has been attached. These two molecules have been attached, and this formulation was having a particle size of 12.5 nanometer and polydispersity index of 0.15, which shows that the monodisperse formulation was there. So this formulation was prepared. Basically, it is a nano formulation. You can see the drug molecule is modified by attaching this vitamin E, TPGS, and octizionol. And these are basically they are just like a micellar formulation, and they improve the permeability of the drug. So a higher amount of drug can be. This vitamin E TPGS is another formulation. It also inhibits the efflux transporters. Next, please. Here you can see if a drug is given only plain drug, in extreme right, you can see only drug is given. This drug gets into the systemic circulation, and a small amount of drug reaches inside the posterior chamber. But if the drug is combined with ETPGS, vitamin E TPGS, here you can see red drug and green TPGS, this mixed micellar formulation is there, then it is easier for it to penetrate. So it is going inside. And next, please. Here, once inside the sclera, you can see here there are, in case of retina, here see you have two types of transporter cells are there. Here the drug is released. Now, once the drug reaches here, now their influx transporters are those proteins which promote the transport of drug inside the cell, and efflux transporters which throw out the drug. efflux transport होते हैं और ड्रग जो आपके सेल के अंदर जाती है उसको बाहर फेंक देते हैं, तो उससे ड्रग की कंसंट्रेशन कम हो जाती है. To prevent that, this vitamin E TPGS has another property that it inhibits this efflux protein. This green you can see, it inhibits this. Once it is inhibited, it will not throw out the drug. Otherwise, the drug would be thrown out. So this is the further advantage of formulation of this mixed micellar formulation with vitamin E TPGS. Next, please. This is a video. I would request you to kindly, yeah. It has a voice also. अगर आपका optimize होगा कंप्यूटर की voice.
Sir, there is an option share your computer sound. In three dots, this is visible.
यहाँ पे
More option is there.
इस पे it is not moving.
So basically it is an implant which जो दिखा रहे हैं इसमें, ठीक है. ये इतना simple है, it is so easy. You can see in your hand also, fingertip, and this implant is placed around the sclera.
Just wait. We are
Then is micro interest targeted delivery is there.
वीडियो जो चला रहे हैं उसमें साइड में हम प्रेस निकल पा रहे, स्क्रीन लॉक हो गया एक बार देख. अच्छा वीडियो. Please wait, we are correcting it. Just a minute. Vivek,
Yes,
Vivek,
sir.
can you listen us?
Yes, sir. I'm hearing you, sir.
I'm not able to move this. My screen is locked.
Sir, your screen is sir. This is PowerPoint presentation, sir.
Yeah, I'm not. No, I am not able to move the camera showing our videos. I'm not able to move these.
Sir, video is available in your PPT folder, sir.
Yeah.
Yeah, there is video. You can check also. You can please.
Can you see my cursor? I am not able to minimize
Yes, sir.
it.
Yes, sir. Sir, there is a solution, sir. You can also use another method. You can minimize the PPT and you can play the video via your VLC, and it will show to all of us. So I think this
No,
is the
video.
best solution.
It is video is playing. Why it is locked? I am not able to move.
Sir, I think in PPT module there is an attachment. I think that attachment is failed. So you can play video on another on your computer, and you can share that screen also, sir.
Video is playing, but the voice was not.
Voice is not coming. See.
Okay,
Anyway,
voice is
कोई
not
बात नहीं.
coming.
आप चला दें इसे, मैं ऐसे ही बता दूंगा.
Sir, you can explain it now because
Okay.
I have to see the computer first, then I can resolve this.
Okay.
I'm
Okay. No
far from
problem.
you, sir.
No
So,
problem.
okay, sir.
आप इसे चला दीजिए, डॉक्टर.
Yeah, it is moving, sir. Please.
Yeah. So this is the trademark of this Amorphex Therapeutics. They have prepared a topical ophthalmic drug delivery device. Now you can see this device. It has a curvature, peripheral curves, edge, apex. You can see everything. It can easily be inserted into the eye. The shape is such that it can be easily folded. It can easily be inserted into the eyelid. It will not cause any pain. It will be easier to administer. Very simple is there. You will see now that if the screen will move, you will see.
No, there is no audio.
Yeah, it is moving. Video is moving, and you will see that it is so easier to administer. He will show here on his fingertip. He will show the device. This is, you can see, is so small. You can see less than around 2 centimeter is the entire this. This is the device on the fingertip, and this is the curvature it is showing, and this all dimensions it is showing, and it can easily be inserted into the eyelid. लेजर से ऑप्टिकल हटाना सेफ है. चश्मा, yeah, but I will answer the questions later on. You can see that how this person is putting this. Many of you might have used contact lenses, so it is much easier. आजकल तो disposable contact lenses people use for cosmetic purposes also, for the color of their eyes. So ये तो drug delivery के लिए you can see he is putting there. And you can't even see where he has put the eye drop or this formulation. आंखों में ऊपर चलेगी, किसी को कुछ पता ही नहीं चला. ठीक है ना? It is much easier. It dissolves there. You can see here slightly there. It is over a period of time it dissolves also. You can also use certain polymers where you can, if you wish to remove, you can remove also, or otherwise it will dissolve there. So there is no problem. Once a drug is administered, you put there for 1 day, you put it there in the morning, you don't have to administer the drug again and again. In case of topical delivery, you have to put eye drop after hours. It is recommended that you should give administer eye drops at a regular intervals, 2 hours, 4 hours, something like that. So it is showing that this is here he has, they have designed it for weeks also. आप सो भी जाएंगे तब भी आपको कोई दिक्कत नहीं है, आप डाल के कुछ भी आपको आइडिया ही नहीं रहेगा, you will not able to come to know कि कुछ ड्रग भी डाला भी हुआ है आंख में. Next slide please. Then is the microneedle approach. In case of micrometer, here what is microneedles? These are the small scale, micrometer scale arrays of needles. You can just put a patch which is having a small microneedles. Now with the advancement of 3D technology, 3D printing technology, I think we can also design micrometers of this size. So these micrometer needles are already available. They can, you can make microneedles of metal also, micrometers of your polymer also. This can be easily prepared. Commonly available, there is one company in Singapore which is having a patent on this, and they are making these microneedles. So these microneedles, so that if you will not even come to know, if you keep microneedle on your fingertip, it will go inside and a drug will be delivered and you will not able to come to know. And I think all these technologies have come from defense also, because you can administer anything. आपको पता ही नहीं चलेगा, अगर कुछ से पॉइजन भी लगा हुआ है, किसी का टच भी कर लिया उसके अंदर चला जाएगा, मालूम भी नहीं चलेगा टच करने पे भी. और ये टेक्नोलॉजी ऐसे नहीं डेवलप हुई है, ये दे हैव सीन, ये जो बायोलॉजिकल ऑर्गेनिज्म से देखे हैं आपने, चीज इंसेक्ट से देखा, ऑब्जर्व किया टेक्नोलॉजी, उनके जहाँ पे होते हैं टच, आपको मच्छर काटता है, यू कम टू नो, यू डोंट कम टू नो, जब वो अंदर से काट के निकलता है केवल पता ही नहीं चलता, बाद में पता चलता है मच्छर अंदर आया, उसने अपना प्रोबोसिस अंदर डाला और आपको खून चूस लिया, मालूम ही नहीं चला. तो उसी तरह से व्हाट दे हैव डिजाइंड अ नीडल. So you put it here and you keep it outside. Within 20 seconds, this will deliver the drug. It is minimally invasive. No pain would be there. You would not even come to know. So in this, the tissue is pierced using very micro scale channels also. You can deliver directly drug to the intraocular tissues also. ये कॉर्निया के ऊपर भी रख के यूं निकाल सकते हैं, स्क्लेरा पे रख सकते हैं, सुपरकोइडल डिलीवरी. But one has to be slightly training must be given, and very small amount of, within minutes, seconds, it will deliver the drug, and it is easier to give the drug. Next please. Now इसमें बहुत सारे types की microneedles हैं, large number of microneedles. I will show here. Next please. Here you can see, if it is placed in the over the cornea, it can deliver a drug directly into the intrastromal delivery. Cornea को pass करके भी जा सकता है, क्योंकि cornea के deep जा रहा है, और once it is there, it will deliver the drug. Intratrabecular network, here you can see, this can be used for delivery of drug for the glaucoma cases, and for intrascleral delivery for posterior segment, you have to just keep it there only, very small. And also suprachoroidal, here depending upon the length of the microneedle, you can see how much it can go. अगर थोड़ी सी बड़ी नीडल है तो इसके 3 लेयर हैं, आप देख रहे हैं, स्क्लेरा, कोराइड एंड रेटिना. यू आर नॉट गोइंग डायरेक्टली इनटू द रेटिना, बट आप दे सकते हैं, स्क्लेरा को भी पार कर सकते हैं, थोड़ी और बड़ी होगी तो कोराइड तक आ जाएगी. बाय चेंजिंग द लेंथ ऑफ द नीडल यू कैन चेंज दिस एवरीथिंग. नेक्स्ट प्लीज. So by changing this, you can. Next, please. Now there are ways. One is poke and apply. You can see what is done here. Next, please. जब आप इसको press करेंगे, it will show. हाँ, इसमें क्या है, needle अंदर जाएगी, और जैसे इस पे आप suppose करो stainless steel का, इसके ऊपर drug लगी हुई है. It will go inside and come out again and deliver the drug. Or sometimes they put disposable needles are also there, or some other material is there, which will be delivered inside the cell. Next, please. In case of poke and coat, if you will press, then it will leave the needle inside. आप press करिए, ये देखिए, तो needle अंदर छोड़ दी और बाकी आ गया. And poke and release, उसमें ऊपर कवरिंग थी. Poke and release में entire needle is released inside. So you can design a polymer formulation, which is in case of poke and flow, there's a small micro channel is there. You can deliver a drug through the channel also. You can see here it is there. Now, after inserting this, you can put the drug. Now एक research था इसमें पीछे आप next में देखेंगे. इस पे काम हुआ है पिलोकार्पिन पे. Next please. You can see here in case of A, this is the of normal retina, normal cornea is there. You can see pupil diameter is there. Pilocarpine, you know, it causes meiosis. आपके pupil का size छोटा कर देती है. तो इन्होंने pilocarpine 5 माइक्रोग्राम दिया. A से B में you can see यहाँ पर within it take a lot of time और ये diameter थोड़ा सा ही फर्क पड़ा. In case of you see amount almost similar type of pilocarpine in microneedles it was administered, you can see such a huge change is there. When it is applied from C to D, you can see so much a change is there, so much reduction is there. Compared to your topical pilocarpine, B to D, only a 0.5 mg of microgram of drug is there extra, but application such a greater amount of pupil diameter was reduced. However, to achieve this kind of effect in case of D, in case of F, you can see from E was there and then F 500 microgram of drug. You can see more than 90% of the drug, 95% of the drug was given. Then only this effect could be observed. So you can see the effect of microneedles by administering the drug by microneedle. You can achieve a more than 90%, or you can see 100-fold effect you can observe by use this, because the entire drug is going inside. So this is one of the study. You can see they have done after this many other studies have been done. Fluorescein and all this have been observed. So this is one of the promising approach which can be used for delivery of drug. Next please. Now, ocular ionophoresis. Ionophoresis, now you know it depends upon the phenomenon of repelling of charges because of the different charge. If your drug is anionic, you put another negative charge, it will be repelled. If your drug is cationic, you put positive charge, it will be repelled. So it is a non-invasive technique. It can be easily used for enhancing the penetration of drugs. Those drugs which are having, it is showing a schematic diagram. You put this formulation in front of the patient and you apply the charge. If your drug is negative, you apply negative charge and the drug will go inside like this. For positive is there, you apply the kind of charge, it will cause the drug to go through it. Here there is a one video also which will show. Yes, please, can you please show the next slide? Ocular, yeah. Here you can see there is a visual X system is there. Here the drug is applied, applicator. This drug dosing controller is there. This drug applicator is placed here, and by changing the charge, you can control the delivery of drug. This figure is showing the process of application of drug. Here the drug is not placed on the cornea but on the sclera, and the drug is entering directly into the vitreal chamber. So this is one of the easiest method for delivering. Injection लगाने की जरूरत नहीं है. Drug will go directly into this. So this is non-invasive method and patient-friendly method is there. Next, please. This is the video. Here you can see this. I get what they are doing. They are taking the drug and putting into this applicator. जो आपको पीछे visual applicator दिखाया था. This is the applicator. Patient को लेटा दिया. उसकी आंख पे देखो आई ड्रॉप नॉर्मली डालेंगे ऐसा. इसके केस में क्या करेंगे, उसका आई को आई लिड्स को पकड़ लेंगे और उसके ऊपर ये डालेंगे. दिस इज शोइंग द मैकेनिज्म. यू कैन सी method of action is ionophoresis, easy to use, non-invasive, needle free. It is showing the mechanism of action here. You can see these are the drug molecules. Because of repelling, they will go directly inside. So in the first step, they prepare the applicator and program in the this patient is counseled and asked to lie down, and then तो उसमें आप पीछे वाला था, उसमें ये दिखा रहे थे वीडियो में कि कैसे ड्रग जाती है पेशेंट को लेटा करके और within a 5 minutes you can deliver a dose of a drug for a entire week or month. You can see here they are preparing this.
Sir, just a minute.
No problem.
एंड करना पड़ा मीटिंग को. आप उसमें बोल दो कि मैडम जब तक एंटरटेन कर देंगे, मेरी आवाज़ नहीं जा रही है इसमें. हाँ,
आपकी आवाज आ रही है.
कोई
आप
टेक्निकल
इसको
इशू है.
आपको जो मैंने वो दी है ना, भेजी है, फोल्डर भेजा है, उसमें फाइल है.
करो फटाफट, सेकंडों में करो.
दोबारा
Now there were certain questions in the meantime. जब तक है मैं आपके questions को भी कुछ देख लेता हूँ. तो
there is some
शमशाद
technical issue.
ये शमशाद सेफी ने पूछा है, सर क्या लेजर से ऑप्टिकल हटवाना सेफ है? यस बेटे, आपका कहने का मतलब है कि मायोपिया का ऑपरेशन कराना, बट उसके लिए कुछ रिक्वायरमेंट है आजकल, क्योंकि इट इज एथिकल इश्यूज हैं. डॉक्टर को पैसे कमाने के एंगल से नहीं सोचना चाहिए. इसमें क्या करा जाता है, पहले जमाने में लेजर अलग टाइप की होती थी, आजकल लेजर बहुत अच्छी आने लग गई है, तो उसमें बहुत एक्यूरेट करते हैं. व्हाट इज डन बेसिकली, उसमें जो कॉर्निया है, कॉर्निया का कर्वेचर चेंज करते हैं, ताकि लेंस तो हाथ नहीं लगाते, कॉर्निया की कर्वेचर चेंज करते हैं. तो उसके लिए वेरी इंपॉर्टेंट कि कॉर्निया की आपकी सफिशिएंट थिकनेस होनी चाहिए. सबसे पहले इट इज वेरी इंपॉर्टेंट टू नो कि आपके कॉर्निया की थिकनेस क्या है, और आपकी आई स्टेबलाइज हो जाना चाहिए, आपका जो नंबर है वो स्टेबलाइज हो जाना चाहिए. यानी मर्दर क्योंकि क्या होता है, एज के साथ आई बाल का साइज बड़ा होता रहता है, और आई बाल का साइज बड़ा हो जाएगा तो वो चश्मा का साइज नंबर बढ़ता रहता है. तो जब आपकी आई बाल का साइज बराबर हो जाता है, बढ़ता नहीं है, देन वन कैन इजीली यूज ये सर्जरी करानी चाहिए. अदरवाइज बाद में भी नंबर पड़ेगा चश्मे का, तो वो करानी चाहिए. और दूसरा उसमें ये होना चाहिए कि कॉर्निया का थिकनेस डिटरमाइन जरूर करनी चाहिए. कहीं ऐसा ना हो कि वो उनका तो कमर्शियल एंगल होता है, एडवर्टाइजमेंट करते हैं और पेशेंट को कह दें कि भाई हो जाएगा और करने में उसको डैमेज हो जाए. तो इसमें बेसिकली लेजर से कॉर्निया का कर्वेचर चेंज करते हैं ताकि इमेज वहां पे बने. तो थोड़ा सा उसमें स्लाइस ऊपर से काट करके वापस उसको फ्लैप को लगा देते हैं, कुछ बर्न करते हैं. तो इसमें थोड़ा सा रिस्क ये है, इन्फेक्शन के चांस होते हैं, बट प्रोबेबली सेफ है, इतना दिक्कत नहीं है. हमने बहुतों को देखा है यूज करते हुए. बस ओनली ये है कि उसका थिकनेस जरूर होनी चाहिए. तो किसी अच्छे डॉक्टर से जो कंसल्ट करना चाहिए, जो सर्जन से, जो ये पता लगा ले कि थिकनेस कॉर्निया की सफिशिएंट है कि नहीं. दूसरा, ये एक्सपेक्टेशन नहीं होनी चाहिए कि पूरा नंबर ठीक हो जाएगा. अगर बहुत ज्यादा है नंबर, -10, -13, -15 समथिंग लाइक दैट, तो इनिशियली उनके लिए रिकमेंड होता था, क्योंकि चश्मा लगाना बड़ा मुश्किल होता था. लेकिन लेटर ऑन आजकल कॉस्मेटिक रीजंस के कारण बहुत से लोग कराते हैं, तो अगर नंबर कम है तो आसानी से ठीक हो जाता है. लेकिन समटाइम्स पूरी तरह से क्लियर नहीं होता, तो वन शुड बी अवेयर ऑफ दिस. ठीक है ना. वो सिर्फ मायोपिया को ट्रीट कर सकते हैं. हाइपरमेट्रोपिया के लिए जो बाद में जो डैमेज हो सकते हैं अंदर, वो अलग है, वो तो किसी के साथ भी हो सकते हैं. दूसरा क्वेश्चन था, इज इट पॉसिबल टू चेंज द आई कलर परमानेंटली? देखो, आंखों के साथ में पंगे नहीं लेने चाहिए. ठीक है, ये तो हमारा आई जो है नॉर्मल है, टिश्यू है, तो आई कलर परमानेंटली चेंज नहीं करना चाहिए. उसमें क्या है, बेसिकली ये पिगमेंट का कलर है. दिस इज द कलर ऑफ योर आई पिगमेंट, जो मेलानिन या जो आपका कलर है उसके कारण से आया है. तो अगर आप उसके कलर को चेंज करने की कोशिश करेंगे तो दैट वुड बी अ प्रॉब्लम. तो मुझे नहीं लगता ये करना चाहिए. देयर में भी सम, होता तो नहीं है, लेकिन देयर में भी सम जिसमें ये करा जा सकता होगा, कोई होगा तो आई एम नॉट अवेयर. बट अगर ऐसा है तो आई वुड नॉट सजेस्ट कि करें, क्योंकि जब स्किन का कलर चेंज करने के लिए आप डीपिगमेंटिंग एजेंट यूज कर सकते हैं, ये कहते हैं. और कितना अच्छा है कि कॉन्टैक्ट लेंसेज अवेलेबल हैं. आज आप नीला रंग कर लो, कल हरा कर लेना, परसों पिंक कर लेना. तो डिफरेंट टाइप्स ऑफ कॉन्टैक्ट लेंसेज आर देयर. अगर आपको शौक है किसी को, तो मतलब आराम से कलर चेंज कर सकता है ना. कभी ऐश्वर्या राय की आंखें, कभी किसी दीपिका पादुकोण की आंखें, किसी की आंखें बना सकता है. ठीक है ना. तो इट इज वेरी इजी कि वो करा जाए, छेड़छाड़ नहीं करनी चाहिए. अगर कोई और क्वेश्चन भी बीच में पूछना चाहें तो यू कैन आस्क, जब तक ये.
Any more queries? किसी स्टूडेंट का कोई और क्वेश्चन है, किसी पार्टिसिपेंट का, किसी का कुछ डाउट है, तो यू कैन आस्क नाउ टिल आवर टेक्निकल इशू रिजॉल्व्स।
आप ओकुलर डिलीवरी पे पढ़ते हैं, कॉमनली है। अच्छा, मैं आपको कुछ टिप्स देता हूँ आइज़ के लिए। ये है कि आइज़ की ब्लिंकिंग करते रहना चाहिए। वी शुड रेगुलरली ब्लिंक आई। आप देखेंगे जब आप आइज़ को ब्लिंक करते हैं तो आपको बड़ा ही रिलैक्सेशन मिलता है, ठीक है। और एक पामिंग एक्सरसाइज है, वो हर किसी को करनी चाहिए। हाथों को आप सब जानते भी होंगे, हाथों को ऐसे रगड़ के उंगलियों को फिर आंखों के ऊपर ऐसे कवर करना चाहिए। आप ऐसे करके देखेंगे, आपको आंखों को रिलैक्सेशन मिलेगा। तो ये बहुत ध्यान रखना चाहिए। अब आई ड्रॉप्स कैसे यूज करनी चाहिए? आई ड्रॉप्स का आप सबने पढ़ा है, वी ऑल हैव स्टडीड, आपकी बुक्स में दे रखा है, नहीं तो आप पढ़ेंगे ध्यान से। तो आई ड्रॉप की बॉटल के ऊपर भी लिखा होता है, डू नॉट टच द टिप ऑफ द नोजल टू योर आई। उसका कारण क्या है? क्योंकि देखो, दे आर मल्टीपल डोजेज वाली आई ड्रॉप भी हैं, आपका एक सिंगल एप्लीकेशन वाली भी होती है। सिंगल एप्लीकेशन वाली आपको मार्केट में नहीं मिलेगी, मोस्टली हॉस्पिटल्स में जहाँ पर ऐसी सर्जरी करी जाती है जहाँ प्रिजर्वेटिव नहीं यूज कर सकते, वहां पर होती है। अब आप आई ड्रॉप कोई भी यूज करते हैं, लार्ज नंबर ऑफ ड्राइव्स, कॉमनली लोग टीयर प्लस, और एक आयुर्वेदिक आई ड्रॉप है आईटोन, हिमालय की ऑप्था क्या, मैनी पीपल यूज फॉर कॉमन डे टू डे यूज, बिकॉज आई में पेन है, थकान हो गई, सर्जरी या इन्फ्लेमेशन है, रिलैक्सेशन के लिए भी यूज करते हैं। तो उन सब में प्रिजर्वेटिव होता है। तो प्रिजर्वेटिव इसलिए डालना पड़ता है क्योंकि अगर 30 दिन के अंदर वो, जब आप उस ढक्कन को खोलते हैं उसमें माइक्रो ऑर्गेनिज्म एंटर कर जाएंगे, और माइक्रो ऑर्गेनिज्म एंटर कर जाएंगे तो वो जिसमें प्रिजर्वेटिव है वो उसको किल करेगा। इट विल टेक सम टाइम। तो अगर आप टिप को टच करेंगे आइस के साथ में तो ज़्यादा चांसेस हैं माइक्रो ऑर्गेनिज्म एंटर करने के, तो ज़्यादा काम करना पड़ेगा। तो उसको टच नहीं करना चाहिए, ना हाथ से टच करना है ना आई को उसे टच करना है, नोजल को। दूसरा, यू शुड यूज इट विद इन 30 डेज ऑफ परचेज, खोलने के बाद में जो उसका डेट दे रखी होती है उस पर डेट लिख लेनी चाहिए। जिस दिन आपने आई ड्रॉप खोली, विद इन आपकी शेल्फ लाइफ में जो भी आपने आई ड्रॉप खोली, अगर उस पर आप आज की डेट जैसे 21 अक्टूबर डालेंगे तो 21 नवंबर तक आप उसको यूज करें, उसके बाद उसे डिस्कार्ड कर दें। बिकॉज जो उसमें प्रिजर्वेटिव डाला जाता है वो इतनी अमाउंट में डाला जाता है कि बस वो उसको 1 मंथ तक उस पर काम कर सके, आफ्टर दैट उसकी गारंटी नहीं दे सकते। फॉर्मुलेशन हैज टू पास प्रिजर्वेटिव चैलेंज टेस्ट। तो जो ऑप्थेल्मिक फॉर्मुलेशन होती है प्रिजर्वेटिव चैलेंज टेस्ट में इतना ये देखा जाता है कि एटलीस्ट वो 1 मंथ तक उसको उसमें माइक्रोनिज्म होगा, धीरे धीरे वो खत्म हो जाएंगे, तो फिर इन्फेक्शन के चांस बढ़ जाते हैं। दैट्स वाई। और तीसरा, जब आई ड्रॉप डाली जाती है तो कैसे डालनी चाहिए? आपने जैसे आई ड्रॉप डाली, चश्मा उतारा, मतलब जैसे भी आई ड्रॉप डाली, आंख खोली, और ये कंजक्टिवा को ऐसे पकड़ना है नीचे से, लोअर आईलिड को, अपर आईलिड को। अगर कोई और डालता है तो ठीक है, नहीं तो आप अपने आप डाल रहे हैं तो खोल के आप आई ड्रॉप में ऐसे डालेंगे। तो आप आईज को ऐसे रिटेन करें, मतलब ऐसे रखें, आईज को सीधा रखें, या तो लाई कर लें। अगर बैठ के डाल रहे हैं तो सिर को ऐसे रखें, और आंखों को बंद करके ब्लिंकिंग नहीं करनी, जस्ट क्लोज योर आईज। ब्लिंकिंग करेंगे तो उतना ज्यादा होगा। फिर आपने यहाँ पर अपने नेसल पंक्टा, नाक के पास है, इसको दबा के रखें 5 मिनट के लिए। जब आप इसको दबा के रखते हैं तो जो आपकी दवाई जो आंख या नेसल पंक्टा से नाक से गले में जाती है वो रुक जाएगी। तो ड्रग विल रिमेन इनटू द आई फॉर प्रोलॉन्ग पीरियड ऑफ टाइम। तो नेसल जो ड्रेनेज होती है वो रुक जाएगी, एंड मोर अमाउंट ऑफ ड्रग कैन एंटर इनटू द आई। एंड इट इज रिकमेंडेड कि ड्रग को सीरियस केसेस में, जैसे ग्लाउकोमा का पेशेंट है या दूसरा भी है, कभी कंजक्टिवाइटिस भी है, तो वो उसको 5 बार, 6 बार, 7 बार, 8 बार डाले, क्योंकि ये 15-20 मिनट के बाद तो पूरी ड्रग वॉश आउट हो जाती है। ठीक है। एक तो आपको आंसू, हर किसी को वैसे भी नॉर्मली टीयर्स निकलते हैं। ब्लिंकिंग इज वेरी इंपॉर्टेंट। जब आप ब्लिंकिंग करते हो तो ये वाइपर की तरह काम करता है। जैसे हमारे गाड़ी पे वाइपर होता है, वो गाड़ी पे पानी गिरता है तो वो वाइपर उसको साफ करता है। ऐसे जब आप ब्लिंकिंग करते हैं तो टीयर्स जो हैं वो स्प्रेड हो जाते हैं पूरी कॉर्निया के ऊपर, पूरी आई के ऊपर। और ब्लिंकिंग करने से क्या होता है, जब वेन एवर यू ब्लिंक, आप देखो छोटे बच्चे को देखो कितना सुंदर ढंग से ब्लिंक करता है। जब बच्चा पैदा होता है वो छोटे बच्चे को देखो बहुत अच्छा ब्लिंक करता है। ब्लिंकिंग इज अ वेरी प्रोटेक्टिव इफेक्ट रिस्पॉन्स, और आपको सुंदर भी लगेगा, देखना भी लगेगा। वो नेचुरल ब्लिंकिंग है, कोई प्रेशर नहीं है। अब हम धीरे धीरे वो हमने रिफ्लेक्स लूज कर दी, तो वो जो रिफ्लेक्स है, ब्लिंकिंग रिफ्लेक्स, वो बड़ी सूथिंग है। वो टीयर्स को स्प्रेड करती है आइस के ऊपर और वो हमें इन्फेक्शन से बचाती है, क्योंकि टीयर्स में एंजाइम्स हैं, लाइसोजाइम एंजाइम्स हैं जो बैक्टीरिया को किल करते हैं, डस्ट को रिमूव करते हैं। तो इट इज वेरी इंपॉर्टेंट।
देख तो ले लो भी हो जाए।
होस्ट जैसे बनाऊंगा तभी वो
सो अगर आप और कुछ पूछना चाहते हैं तो मैं बताने को तैयार हूँ। एनी स्टूडेंट जो आपको ठीक लगे आप पूछ सकते हैं।
You can switch on your cameras so that we can take a photograph, group photograph. Student and participants, please switch on your video. So that we can take a group photograph that can be published. Tanishk, Nikhil, Akash, Sunil, Sharma, Anmol, Vijay, just switch on your camera. Miss Javeen, गुलाब जल का यूज कर सकते हैं?
हाँ जी, गुलाब जल आंखों के लिए स्पेशल आएगा। वो वाला नहीं लेना जिसमें एसएस डाला हो, तो वो यूज किया जा सकता है। आई वुड सजेस्ट कि आप तो फार्मासिस्ट हो, आप बना भी सकते हो, लेकिन स्टेराइल हो तो ज्यादा अच्छा है। ठीक है।
पलक, राजीव, निशान, प्लीज स्विच ऑन योर कैमरास। विजय,
जो गुलाब जल स्पेसिफिकली आइज के लिए आता है वो यूज करें, उसमें एसएस नहीं मिला होगा, केमिकल नहीं मिला होगा, एंड इट शुड बी स्टेराइल। अगर स्टेराइल है तो बहुत अच्छा है। ठीक है। वैसे तो हम आंखें धोते रहते हैं, आपने कॉमनली देखा होगा, और लोग छपाक से आंखें धोते हैं, उससे आंखों को डैमेज भी हो जाता है। आपकी आंखों को कभी रगड़ना नहीं चाहिए। जब आप रगड़ते हो, जैसे सपोज करो मैंने इतना ही रगड़ लिया तो मेरे कॉर्निया के सेल डैमेज हो गए। तो आंखों को नॉर्मली रगड़ा मत कीजिए, उसको कॉमन सिंपल आई ड्रॉप यूज कर सकते हैं। इंडिया में मैं किसी का एडवर्टाइजमेंट नहीं कर रहा, बट कॉमनली आई ड्रॉप्स कॉमनली मैंने देखा है लोग आईटोन, ऑप्था केयर और काफ़ी सारी आई ड्रॉप्स हैं वो यूज़ करते हैं। आई ड्रॉप डालने तो कईयों को जलन होती है और उसका कारण आपको मालूम ही होगा। या तो उसका पीएच डिफरेंट होता है, या उसकी टोनिसिटी डिफरेंट होती है, या पार्टिकल्स होते हैं, तो वो करते हैं। आंखों में अब आपको कोई पार्टिकल चला जाए, जो सस्पेंशन है वो आंख में डाल सकती हो, लेकिन इट शुड बी माइक्रोफाइन सस्पेंशन। 90% ऑफ द पार्टिकल्स 10 माइक्रोमीटर से कम होने चाहिए। अगर 10 माइक्रोमीटर से कम है तो हमारी आई जो है एक किस्म से वो आपको पता नहीं लगा पाता, डिटेक्ट नहीं कर पाता उस मटीरियल को, वो देख सकते हैं। ब्लरी विजन, ब्लरी विजन के लिए क्या कारण हो सकता है? या तो आई साइट टेस्ट कराई जाए, और अगर आई साइट में ब्लरी विजन के लिए बहुत सारे रीज़न हो सकते हैं। समटाइम्स आई इज़ नॉट, मतलब आंखें खराब हैं, कमज़ोर हैं, तो टेस्ट करानी चाहिए, तो ब्लरी विजन ठीक हो सकता है उससे। मतलब इट इज़ इम्पॉर्टेंट टू गो टू दी फिजिशियन, पता लगाया जाए, मतलब ऑप्थेल्मोलॉजिस्ट के पास कि ये क्यों है। वन शुड नॉट रिजेक्ट इट।
हो गया, आगे विजय बताए।
yes sir.
So now screen is visible. Kindly.
Yeah, please. This next slide please. तो इस वीडियो में आप देख सकते हैं, पीछे वाला वीडियो था, इसी के लिए सब सर ने किया, तो आप देख सकते हैं कैसे ये बहुत इजी मेथड है पेशेंट को।
आवाज आ रही
No, sir.
आप करिए।
जब आप स्क्रीन शेयर कर रहे थे ना, नीचे 2 बटन क्लिक करने थे, आपको टिक करने थे। ऑप्टिमाइज स्क्रीन फॉर वीडियो शेयरिंग के लिए, साउंड के लिए, आपके कंप्यूटर की साउंड अगर आप ऑप्टिमाइज करेंगे तभी दिखेगा। एनीवे आप ये देख रहे हैं, नहीं, जब आप इसको स्क्रीन शेयर करने लगते हैं तो उसमें नीचे 2 पॉइंट्स आते हैं, 2 उनको आप टिक करते हैं, ओनली देन जब आप स्क्रीन शेयर करेंगे, जैसे आप क्लिक करते हैं स्क्रीन शेयर को,
आप शेयर करें।
उसके नीचे दो ऑप्शंस आते हैं, दो ऑप्शंस आते हैं।
Yes, sir. We are moving it. Yes. From current. Yeah. Just close it. Just do the screen sharing. Oh yeah. चलाइए। Now, put it.
Yeah, now it's
The iGate 2 device is a breakthrough
Sir,
ocular
the
drug
voice is
delivery
coming?
system that
Yes.
provides
Yes, yes.
substantially higher ocular drug concentrations than eye drops, with far less patient risk and discomfort than an ocular injection. The iGate 2 device employs ionophoresis as its mechanism of action. This simple, easy to use, non invasive, and needle free drug delivery method safely and effectively propels active ingredients deep into ocular tissues. The first step of the ionophoresis procedure begins as the technician or doctor fills the applicator with the drug product. The technician or doctor then programs the generator in 2 easy steps, setting both the dosage and the current. Next, the physician puts a small electrode on the patient's forehead and applies a small amount of topical anesthesia to the surface of the eye. The ophthalmologist or optometrist then places the drug-loaded ocular applicator onto the eye. For the patient, it's as comfortable as putting on a contact lens. The drug delivery process begins when a very small electrical current from the handheld generator is applied to the electrode embedded within the applicator. At the electrode, the current electrolyzes water molecules within the applicator, converting them into either hydronium or hydroxide molecules, depending whether anodic or cathodic polarity is employed. These ions exert a force upon like-charged molecules known as electrorepulsion, which is based upon the principle that like charges repel one another. This electrorepulsion between the newly created ions and like-charged drug molecules drives the drug molecules into the ocular tissues until they reach the anterior and posterior segments of the eye. The iGate 2 treatment takes just 1 to 4 minutes, at which point the ophthalmologist or optometrist removes the applicator from the surface of the eye and the procedure is complete.
Next, please.
So is it visible?
हाँ, ये ऊपर से कुछ ये थोड़ा हिलाएंगे.
Yes, sir.
Non-biodegradable implants. Implants are also there. Polymeric implants, you can see. So 2 types of implants can be prepared. Those in this case, the polymers used, they do not dissolve. So they can be used for delivery of drug for a prolonged period of time. For example, 1 year also. If you can give a drug for you have not, because they will not dissolve, and after the drug is delivered, you can remove them also. They can increase the amount of drug, half-life of the drug into the eye, and they can also use for stabilization of drug into the eye. And because once patient has not to go to again and again to the ophthalmologist, so there is an improved patient compliance. Once you have taken a 1 year, there is no river. But in this case, the drug is to be, these implants are to be placed surgically, and after the drug is delivered, they have to be removed. So once or twice in a year, they have to go and can be used. Another is with the, can also prepare biodegradable implants. Once they are placed there, they dissolve and release the drug. So because they are dissolving, they can release the drug only up to certain weeks and months. They also increase the half-life. Then next, please. Now, intravitreal implants, there are two types of, here you should, one is Ozurdex and another is the applicator. This is the applicator and this is the implant for dexamethasone intravitreal implant is there, biodegradable implant is there. It can be injected using this applicator directly. Here the implant is given directly into the eye. So because it is a biodegradable one, there is no need to worry and it will dissolve over a period of time. Next, please. Here again, the video is there, if you can play. और आप लास्ट में देख सकते हैं, आंख में आपको दिखेगा, इसमें दिखाई भी देता है अंदर पड़ा हुआ वो इंट्रावेंट्री इम्प्लांट. नेक्स्ट स्लाइड प्लीज. Another approach is use of transporter targeted delivery system. Here the there are proteins which are bound with the membrane. They transport active transport of molecules. Where proteins are there on the cornea, conjunctiva, and retinal epitheliums. There are two types of influx and efflux transporters. जो उनके ट्रांसपोर्टर प्रोटीन है, ये एग्जांपल्स दे रखे हैं. सो अगर आपका जो ड्रग मॉलिक्यूल है, इफ यू बाइंड विद दिस, like in case of vitamin C transporter, if your molecule is having a structure analogous to vitamin C, or if you combine the vitamin C with your drug, it will be uptaken using this transporter. So there are different transporters which have been shown here. You can make your modify your molecule to attach it with the transporter. It will be then transported inside the through the membrane inside the eye. Next, please. Next slide, please. Yeah, there are certain efflux transporters also, like this ATP binding efflux transporter. Here you can see, if you will press, this is the molecule. आप press करेंगे इसको, नेक्स्ट बटन प्रेस करेंगे तो ये मॉलिक्यूल है, आप देख रहे हैं, दिस इज सेल मेम्ब्रेन. ये इनफ्लक्स ट्रांसपोर्ट से अंदर गया साइटोसोल से, फिर ये इफ्लक्स ट्रांसपोर्ट ने बाहर निकाल दिया. बट अगर इसके साथ आपका मॉलिक्यूल अटैच्ड है, लाइक दिस हियर ट्रांसपोर्टर इज अटैच्ड, नाउ इफ यू विल प्रेस हियर, इट विल गो इनसाइड बट इट विल नॉट कम आउट, बिकॉज हियर द इफ्लक्स ट्रांसपोर्टर, दिस मॉलिक्यूल इज कैनॉट पास थ्रू because of this protein attached here, it is not able to pass through, and here it is released. Similarly, this is next please. So you can deliver the drug inside the cell. Here also you can see there are various proteins transporters, it is showing here, which can be used for delivery of drug. All these transporter proteins have been shown, and one can design a molecule, उसको बहुत सारे ट्रांसपोर्टर लगा करके इसके थ्रू उसको अंदर ड्रग को भेजा जा सकता है. This is just like a pass. You have a I card or identity card when you enter your institution. It is just like a pass that you can go inside. So this is again showing the proteins on the blood retinal barrier in the retina blood vessels passing to the retinal capillaries. You can combine the molecule with there. Next, please. Next slide, please. Another approach is we told you about prodrugs. Here you can see acyclovir has been substituted with various amino acids like valine, glycine, valine, tyrosine, valine, and some like this. So by attaching these prodrugs, we also improve the solubility. We also, because this there are certain transporters for amino acids, and because of these amino acids, attachment to your acyclovir, the acyclovir can be easily delivered into the eye. Acyclovir is commonly used for your herpes infection, viral infection, herpes simplex infection of the eye. It is most commonly used. So eye drops are available, which have been used for this. Next, please. तो ये स्टडी की गई और देखा गया जब यू कैन सी रेड लाइन, ये जो कर्व है, ओनली अ स्मॉल अमाउंट ऑफ ड्रग concentration was reached there. In case of acyclovir, when acyclovir was combined with valine acyclovir, you can see blue line is there, higher level is obtained. And when valine acyclovir was used, you can see this black line is there, higher level was achieved. This is only because the acyclovir was modified, its property changed, and it entered into the anterior chamber at a much higher level. Next, please. ये कुछ और एग्जांपल हैं बताए हुए हैं कैसे हुआ. आप ये देख सकते हो कि अलग अलग ट्रांसपोर्टर्स हैं जो कॉर्निया के ऊपर, जैसे एसाइक्लोविर को एल एस्पार्टेट के साथ बाइंड किया गया, प्रो ड्रग बनाई, एंड 4 times हायर अमाउंट ऑफ ड्रग एसाइक्लोविर पहुंची. इन केस ऑफ वेलाइन 3-4 हायर, ग्लाइसिन वेलाइन गेनसाइक्लोविर बना, वेलाइन में गेनसाइक्लोविर. You can see in this case 2-4 higher. So what out of this what we can conclude that for delivery of drug to the posterior segment is very difficult, and to achieve the drug we cannot depend upon one technique. We have to use a different types of strategies to deliver drug particularly posterior segment. एंड ये जो रिसर्च हो रहा है हम अपने लैब में कर रहे हैं, ये पेशेंट तक क्यों नहीं पहुंच पा रहा? व्हाई इट इज नॉट एबल टू रीच टू द बेड साइड? बिकॉज वी हैव नॉट बीन एबल टू डिजाइन अ नॉन इन्वेजिव सिस्टम. अगर इंजेक्शंस बनाना है, ये करना बड़ा डिफिकल्ट है. अभी आपने 2 सिस्टम देखे, विजुलेक्स सिस्टम इज देयर, और जिसमें बहुत सारी ionophoretic सिस्टम है, मैनी बहुत पोटेंशियल है उसका, बिकॉज इट इज पेशेंट को कोई दिक्कत नहीं है और इट इज इजियर टू एडमिनिस्टर. एक बार कर दिया तो वो काफी समय तक रहेगा, और ये केसेस पढ़ने वाले हैं आने वाले टाइम में. यू नो डायबिटीज इज इंक्रीजिंग डे बाय डे, एंड इट इज वेरी इंपॉर्टेंट, क्योंकि डायबिटिक से रिलेटेड जो कॉम्प्लिकेशंस हैं उसमें आईज की बड़ी प्रॉब्लम होती हैं. तो पीपल बिकम ब्लाइंड. सो इफ दे आर टेकन केयर ऑफ दिस, सो वी कैन ओवरकम दिस. सो दिस वाज ऑल रिगार्डिंग माय talk. I now request you to ask questions, whatever you are maybe having. I would be happy to answer that.
Thank you very much, sir. Nice
Welcome.
presentation, and we have learned a lot. I
Thank you.
hope all the students and all the pharma researchers and undergraduate, postgraduate students, they will be benefited by this presentation. If you are having any query, you can ask, sir. Either you write your message in the chat box, or either you unmute yourself and ask if you are having any query. Mr. Vivek? Vivek, can you listen us?
Yes, sir. I'm listening.
Can you unmute the participants?
Yes, sir. Can you repeat, sir?
Can you unmute the participants?
Yeah, sir.
Side effects of laser surgery.
Sir, participant can unmute from their side, sir, now.
One of the side effect of laser surgery is that one is this psychological effect is that if you are sometimes the number will remain, so the patient will think कि भाई अब तो ठीक नहीं हुआ, एक psychology effect. दूसरा ये है कि साइड इफेक्ट लेजर सर्जरी का अगर बड़ा ही होगा तो आंख में है, अदरवाइज सिंपल थोड़ा सा इन्फ्लेमेशन वगैरह होगी कुछ दिनों के लिए एंड थोड़ा सेंसिटिविटी होती है एंड वन हैज टू टेक केयर फॉर 10 to 15 डेज, वो सब ध्यान रखना पड़ता है. सर्जरी भी हुई है और इन्फ्लेमेशन हुई है तो उसमें एंटीबायोटिक्स और एंटी इन्फ्लेमेटरी एजेंट्स यूज करने पड़ते हैं. अदरवाइज और साइड इफेक्ट तो यही है कि भाई अगर गलत से सर्जरी प्रॉपर नहीं हुई तो वो डैमेज हो सकता है ना? और कुछ इसमें ऐसा नहीं है.
Any more questions? Disadvantage of topical.
टॉपिकल रूट. मेन डिसएडवांटेज तो टॉपिकल रूट का है कि आपको डिपेंड करता है. अगर ओल्ड एज पेशेंट है वो आई ड्रॉप अपने आप नहीं डाल सकता, वो टच करता है, प्रॉपरली ट्रेनिंग नहीं है तो उसको टच कर लेगा नोजल वगैरह को, वो होगा. मेन यही है कि भाई आपको दिक्कत यही है कि दिन में 5 बार 6 बार 10 बार डालनी पड़ेगी आई ड्रॉप को. यू विल हैव टू इंस्टिल अगेन एंड अगेन. और तो कोई डिसएडवांटेज नहीं है इसमें. और थोड़ा स्लाइट इरिटेशन हो जाती है आंखों में, ठीक है. ओरल रूट से आप लेते हो तो आंखों में इरिटेशन नहीं होती, ठीक है, ये बात है. लेकिन इसकी एडवांटेज ओवरकम कर जाती हैं डिसएडवांटेज को, क्योंकि ज्यादा अमाउंट ऑफ ड्रग रीच करती है इसमें. और आप ओरल रूट से ड्रग लेंगे तो उसके और साइड इफेक्ट आएंगे, टॉपिकल रूट में साइड इफेक्ट नहीं आएंगे.
So one question from my side.
Yes, yes.
Nowadays there is a lot of environmental pollution, and most of the persons, they are getting allergy in their eyes, redness, and they are getting the problems itching in the eyes.
Yeah.
So what's should be solution for that?
One should go regular blinking, do regular blinking of eyes, because when we blink our eyes, it is a natural wiper. It will the lacrimal secretion will wipe away, so the tear film will be replaced fast. Once you जब आप ब्लिंकिंग करेंगे टीयर फिल्म रिप्लेस हो जाएगी तो उससे कम इफेक्ट होगा. आई एक्सरसाइजेस करनी जरूरी हैं. सिंपल आई एक्सरसाइज योगा में दी हुई हैं, अगर आप चाहेंगे तो मैं आपको फिर कभी बता भी दूंगा. आई एक्सरसाइज करने से जो उसके मसल्स हैं उनको रिलैक्सेशन मिलेगी और आई की इम्यूनिटी बढ़ेगी. और टीयर्स की सिक्रेशन प्रॉपर होनी चाहिए, तो न्यूट्रिशन प्रॉपर चाहिए. बाकी आंखों को बचाने के लिए ही किया जा सकता है. मतलब आप लोग स्पेक्स वगैरह डालें, ऐसी चीज़ों से बचें जहाँ पर ये ज़्यादा होता है. तो और तो अपार्ट फ्रॉम दैट जो मोस्ट कॉमनली आजकल प्रिस्क्राइब करते हैं डॉक्टर, वो आपको आर्टिफिशियल टीयर्स प्रिस्क्राइब करते हैं, क्योंकि हम नॉर्मली वी हैव लॉस्ट दी ब्लिंकिंग रिस्पॉन्स. रिफ्लेक्स जो है कॉमन है वो हमने छोड़ दिए. आप कभी देखो छोटे बच्चे को, आप देखो जो बच्चा पैदा होता है वो कैसे प्यार से आईज को ब्लिंक करेगा, वो आप सीख लो तो आपको बहुत कुछ हो जाएगा, ठीक है. और मुझे लगता है यहाँ पे कुछ बच्चे हैं जो जिनको चश्मा उतारने का ज़्यादा है, तो अगर आप कोई नेचुरल मेथड अडॉप्ट करना चाहते हो तो मैं आपको सजेस्ट कर सकता हूँ. आप इंटरनेट पे सर्च करें, दे आर वेरियस मेथड्स. देखो आप कोई क्लेम नहीं है, आई डोंट नो, लेकिन हाँ आई साइट आप कह रहे हो, आई साइट बढ़ा दें, स्लाइटली इफेक्ट ऑन आई साइट. तो इफ यू से अरोबिंदो आश्रम इज देयर इन पौंडीचेरी. So they are once upon a time around 25 years back in Delhi, there was one Dr. Agarwal, and they were having a Agarwal Eye Institute in Daryaganj. Now after that he got certain awards also. He devised certain eye exercises also. So these eye exercises are taught in Pondicherry Ashram, and they अब ये इंटरनेट पे भी अवेलेबल हो गई हैं. अभी कुछ दिन पहले मैंने किसी को बताया था, मैंने भी करी हुई है एक्सरसाइजेस. पामिंग है और ब्लिंकिंग एक्सरसाइज है, स्विंगिंग एक्सरसाइज है, और उसमें कुछ लोगों को बेनिफिट हुआ है. अगर आप चाहते हैं, आप टाइम दे सकते हैं तो आप करिए, ठीक है. इसके अलावा आप इंटरनेट पे सर्च करिए, दे आर मेथड अवेलेबल. और एक आई ड्रॉप है मार्केट में, मेरे को पता नहीं है, मैंने यूज़ नहीं किया है तो आई कैंट क्लेम, आइसोटीन आई ड्रॉप है, वो कहते हैं उनके साथ में वो क्लेम करते हैं, आई डोंट नो, यू विल हैव टू चेक, दे से कि हम आई साइट ठीक कर सकते हैं आई ड्रॉप से। कुछ लोगों ने बताया, उसके साथ में कुछ लोगों के एक्सपीरियंस भी हैं, तो आप चेक कर लीजिए, अगर आपको ठीक लगे तो आप यूज़ कर लीजिए। ठीक है, किसी और का एक्सपीरियंस और प्रक्रिया मुझे शेयर करें ताकि मैं औरों को भी बता सकूं। ठीक है ना, तो आइसोटीन आई ड्रॉप है, मैंने देखी है मार्केट में, दे आर क्लेमिंग, बट वो कैसे करते हैं? डार्क सर्कल्स का कोई सोल्यूशन स्ट्रेस आपका एक बहुत बड़ी बात है। आप जो क्वेश्चन पूछ रहे हैं इसका मैंने सर से बात करी है, इन सब का सोल्यूशन आगे मिलेगा। एक्चुअली मैं डॉक्टर नहीं हूँ, मतलब आई एम नॉट ऑप्थेल्मोलॉजिस्ट और फिजिशियन, बट आपकी तरह ही फार्मासिस्ट हूँ, तो सॉल्यूशंस तो बहुत सारे अवेलेबल हैं। दे आर ऑइंटमेंट्स एंड क्रीम्स आल्सो अवेलेबल, जो आप आई सर्कल के नीचे लगाते हैं। कॉस्मेटिक फॉर्मुलेशंस अवेलेबल हैं। बहुत सारे लोग एक कॉमन ट्रीटमेंट भी करते हैं, वो कॉस्मेटिक पर्पसेस के लिए आइज को लेट के आइज पे वो आप कुकुम्बर काट के लगाते हैं। ठीक है, आइज के ऊपर वो करता है। कुछ स्ट्रेस है, कुछ न्यूट्रिशन की रिक्वायरमेंट है, अगर आप प्रॉपर न्यूट्रिशन लेंगे और स्ट्रेस को रिमूव करेंगे तो ये सब चीज़ें, डार्क सर्कल ये सब नहीं होगा। इसमें स्ट्रेस का बहुत बड़ा रोल है जो हम लोग समझते नहीं हैं। काफ़ी सारी चीज़ों के पीछे स्ट्रेस बहुत बड़ा रोल प्ले करती है, और जिसको हम इतना मानते नहीं हैं फार्मास्यूटिकल्स में, लेकिन विद द पीरियड ऑफ टाइम वी विल हैव टू चेंज। ठीक है, सब चीज़ों में चेंज आ गया। वो फ़ोन ऑब्सोलीट हो गया, जो पहले चलता था, अब आज की डेट में हम मोबाइल पे काम करते हैं,
Yes, sir. Yes,
सारी
sir.
चीज़ें
There is.
ऑब्सोलीट होगी। तो अगर हम अपने आप को चेंज नहीं करेंगे तो कल को आई एम फियर कि कल को फार्मास्यूटिकल्स भी जो जिस ढंग से एडमिनिस्टर करते हैं ये सब भी खत्म हो जाएंगे। अगर वेलनेस इंडस्ट्री को देखें तो $3 बिलियन की वेलनेस इंडस्ट्री है। ठीक है, हमारे देश से योगा निकला, सब कुछ निकला, लेकिन अगर आप इंटरनेट से देखेंगे तो यूएसए में आपको वहाँ के लोग योगा करते सिखाएंगे हैं? वो योगा कर रहे हैं, सब कुछ कर रहे हैं, दे आर अर्निंग अ लॉट ऑफ मनी। और हमारे यहाँ पे कोई योगी अगर कहेगा तो हम मजाक उड़ाते हैं उसका कि भाई ही इज अर्निंग मनी, कमर्शियल है। अगर आप यूएस में, कनाडा में जाके देखें, यू विल सी अंग्रेज लोग, वो लोग सीख करके वहाँ पे ये कर रहे हैं, प्रैक्टिस कर रहे हैं, सिखा रहे हैं और पैसा कमा रहे हैं। और हमारे यहाँ पे कोई लेने लगे तो उसको लोग वैसे करते हैं। तो ये बहुत बड़ी $1 बिलियन इंडस्ट्री है वेलनेस की, और इसी को उठा करके हमारे आयुर्वेदिक फॉर्मुलेशंस भी इस मार्केट में आई हैं। लेकिन हम ट्रेडिशनल चाइनीज मेडिसिन को मुकाबला नहीं कर पा रहे, वो लोग हमसे बहुत आगे निकल गए हैं। अगर आप यूएस में, कनाडा में देखें तो वो ज़्यादा मिलेंगी आपको कंपेयर टू हमारी आयुर्वेदिक मेडिसिन। तो आयुर्वेदिक मेडिसिन भी इज़ अ वे ऑफ लाइफ, उसमें सिर्फ आपको मेडिसिन नहीं देते, उसमें आप वैद्य को जब आप बुलाते हैं वो आपकी नब्ज पकड़ के बीमारी का बारे में बताता है, आपका बहुत कुछ करता है, उसी से इस कहानी शुरुआत हो जाती है। और हम लोग तो क्योंकि आवर वे ऑफ ट्रीटमेंट इज डिफरेंट, सो इट इज डिफरेंट, बट वी विल हैव टू चेंज अवर सेल्फ। हमें आपको इनोवेट करना पड़ेगा, फार्मास्यूटिकल्स को भी। आई होप फ्यूचर में काफ़ी बहुत बड़ा चेंज आने वाला है, तो उससे काफ़ी कुछ होगा। अभी तो हम सिर्फ मैन्युफैक्चरिंग पे ही चेंज दे रहे हैं, 3D प्रिंटिंग ले आए, ये ले आए, बट द वे ड्रग्स डिस्कवर कर रहे हैं उस पर हम चेंज दे रहे हैं, आर्टिफिशियल इंटेलिजेंस ले आए। लेकिन अगर हमने ये नहीं किया तो आगे बहुत कुछ होगा, और चीज़ों को भी हमें देखना पड़ेगा। दैट कैन बी टॉक लेटर ऑन, कभी किसी स्टेज पे।
Thank you very much, sir.
वेलकम।
Let's move ahead for one group photograph. Please switch on your camera, all the participants. Hurry up. Rohit Kumar, Sintu Kumar. Vivek, just have some memories of that event.
Yes, sir. I'm taking the screenshot, sir.
Rohit, just stabilize.
Done, sir.
All the participants?
Yeah, sir.
Yes, sir.
Okay, thank you very much. Miss Bharati,
Sir, I will.
Simran, madam, please go ahead.
Okay, sir. Thank you so much, sir. Uh, we have reached to the end of our program. On the behalf of GIP and our fraternity, I extend my heartiest thanks to today's speaker, Professor Dr. Manish Ahuja. He has explained us various ocular and eye system, its related drug delivery system. The knowledge he has provided is quite helpful for all of us in understanding basic as well as the advanced concept related to our ocular drug delivery system. So thank you so much, sir. Our special thanks are also due for all the invited guests, participants, and our students for their precious times. We hope you all like the webinar. Thank you so much for your cooperation and making this webinar very
We will
successful.
send
And
all the participants the participation certificate. So thank
participation
you very much.
certificate
Thank you
we
very
will
much, sir,
provide.
for your precious time,
Thank you.
for your
Namaste ji.
blessings
Thank you.
and guidance.
In future also,
Welcome.
we would like to meet up all of you in this platforms. Thank you so much, all.
Thank you.
Thank you,
Thank
sir.
you, sir. So we are now ending this meeting.
Mr. Vivek. Mr. Vivek, can you end the meeting now?
Yes, sir. Yes, sir. I'm
Yeah.
going to
All the
end the session.
participants, you can leave the